if we can, in common sense terms, because you know a lot of our viewers want to ask, well, what are the tests that you provide? Why are they important? Why should I be interested in genetic testing if I have a child or children, multiple children, with ASD?
Very important question.
Okay.
Yeah, great question, Nancy.
Who wants to answer it?
Yeah, we both can. I'd love the opportunity. So if a family has a child with autism spectrum disorder, it is important for them to know that they can perform a genetic test to get to the reason why. Why does my child have autism? Is there some sort of an underlying genetic alteration, as Bob mentioned, that can help us better understand that child and perhaps what healthcare considerations we should be on the lookout for? And I think that telling a family story is probably the best way to get this point across. And we've had the opportunity to work with a family in Utah whose son's name is Ben. They're very happy to let us use his name. Ben is a 4-year-old boy, and for a couple years the family had been identifying delays in his development that became very clear whenever Ben's younger cousin was sort of surpassing him. So there were delays in speaking, walking. A few of his doctors had proposed maybe he has autism, and the family just, they wanted to know really what was going on. They were on a wait list to see a geneticist at the local university. As you guys might know, often it takes months or even over a year to get in and see a specialist. Ben's pediatrician learned about our company and our genetic testing service, performed the testing, and we identified that he had a chromosome deletion, a condition known as DeGeorge syndrome. Sometimes it's called chromosome 22q deletion syndrome. And this not only explained what had been happening and what the family had been seeing over the years, so it validated their concerns, but it also gave us prognostic information. We could look into the future and say, hey, many children and adults who have this chromosome deletion have some sort of an underlying heart issue. So having that diagnosis got Ben in to see the cardiology division. The next day, they found a heart condition that needed surgery. So he was in surgery only a couple months, within a couple months of having our testing done. And his family has spoken with other parents, and it may well have saved his life.
Absolutely.
Yes. I want to know what makes Lineagen's testing unique, Dr. Bob. I mean, there's a lot of genetic testing labs out there that do CMA and Fragile X testing. What makes Lineagen unique?
Sure, there's a number of things that really distinguish us, and Rena touched on some of them before. That is our focus. Our focus is on ASD and developmental disorders. Arrays can be used for a lot of things to look at the genome. But we've taken the underlying research that started with the work with the large families in Utah, looked at families with multiple cases of autism, and looked at specific genes that were underlying that. That allowed us to identify markers that other people didn't know about previously. We did further work with Children's Hospital of Philadelphia and found more genes we used. What we did then is we took the available technology. Microarrays are wonderfully smart technology. They look at the entire genome, but they're naively smart. They look at it without thinking about it. They look at everything the same. If they were looking at you for cancer, they'd look at the same piece of genetic information. What we did is then make our array enhance in terms of the information content to look at the areas that are relevant to autism and developmental disability. We put more content into the array. We additionally spent a lot of time looking at the array and the results of it. We're not a big production facility. We take a lot of time to look at it, and then our counselors, who are available for counseling before and after the test for families, which is really important, they look at it, they write a report that's understandable for the practicing physician. You know, physicians have a lot on their hands, and sometimes the details they don't really have all about all these things. So they write a very readable report for the physician with comprehensive references on the latest things, and then they write a report for the families.
And there are actually, if I may, 2 other reasons why Lineagen is so special in terms of the testing we provide, and one of them is how we collect a child's genetic information. How do we get the sample? Over 5 years ago, I came out to San Jose, and we went with the family to get a blood draw for his genetic testing, to learn firsthand, I can tell, Shannon, you know this is no easy feat.
You're talking to two moms that have a lot of experience with traumatic blood draws.
It's a stumbling block because for some families they would go, oh, it's a blood draw.
Yeah.
No, I'm not going to do it because it's not worth the trauma for that.
Exactly. I've spoken with so many families over the years who have wanted to find answers, but they've been so afraid to take their child in to get a blood draw. So what we have done is evaluated other methods of collecting DNA, and we are doing a cheek swab. So it's basically like a Q-tip that can be done in the doctor's office. Some parents have even taken the cheek swab kit home so they can do it where the child is comfortable in familiar surroundings.
We're going to keep going here. We were going to take a break, but I think we're going to go to the end of the show. I think that's a good thing to do because we want to, there's still some questions. Okay, so families, you're sitting here at home and you're saying, well, how can I get this? What's it going to cost? How do they access genetic testing through Lineagen? And what are some of the issues about cost, or can you answer that?
Yeah, absolutely. How do you get the test? Go to your doctor. Let your doctor know this is something you want for your child. Many doctors are becoming more and more aware of genetic testing, again, not to diagnose autism, but to identify the underlying cause for autism. You can go to our website, lineagen.com, also our product name, firststepdx.com, and we have a whole team who can talk to your child, to the child's physician, and who can administer the cheek swab kit. Another great piece of news is that many insurers now recognize the value of chromosomal microarray because it can save lives and it can further identify medical issues that need to be addressed for these children. We have a team. One of the other things I wanted to mention about why we're so special, we take that insurance work off of the family's hands, off of the doctor's hands. So many families say, I can't get wrapped up in another argument with my insurer about who's going to pay for this. We have a team that will fight that fight on behalf of the family. So it is something insurers are covering.
But to be clear, we can't buy it ourselves. We need to go through a doctor to do it.
That's correct. This is a test that we believe still is best ordered through the physician, not a direct
your
consumer.
pediatrician, your autism specialist, whomever it may be.
Neurologist, geneticist.
Neurologist, geneticist. Okay. All right. Why is the Act Today for Military Families Run-In Festival important to Lineagen? Why are you supporting us?
Yeah, a couple different reasons. As you guys know, Autism Awareness Month is now. It's also the month of the military child.
Yes, it is.
Every family who has a child with autism faces unique challenges, but particularly for these military families, they may be faced with one of the spouses being deployed. That puts extra pressure on the other parent to understand and learn about all of these things on their own, care for that child, do the therapies. Also, families may move from base to base where they're getting a whole new healthcare team every couple of months, have to re-explain the diagnosis. And what Lineagen can help do for them is provide genetic counseling. As Bob mentioned, we have a team of licensed and certified counselors who can speak with these parents, provide that support over the phone. They don't have to travel to the nearest city to see a specialist. We can help with that. We also have the clear and easy to understand reports Dr. Bob was mentioning that we can help share from provider to provider.
So and one other point that people don't realize, that it's not as well defined as the increased prevalence in Utah, but there is an increased prevalence of autism and other disorders in the children of military families.
Yeah. Yes,
and
there
so
is.
It is
I don't think the Department of Defense has come out with new numbers yet. I haven't seen them.
Yeah, but we don't understand why, but it's an important area, and we know this, as Rita emphasized, it's critical to these families to get the support, and they move around. It's really important to have somebody who helps them through the entire process and can stay with them when they move to another base, another area.
And I know we're short on time, but I would be remiss not to mention that the military insurance is now especially recognizing the value of chromosomal microarray.
So TRICARE.
That's right. They did not cover this testing in the past, but now because chromosomal microarray is so impactful for individuals who have a diagnosis of autism or developmental delay, they are covering this testing, and Lineagen has worked with TRICARE for years now and is able to help administer this testing for those families
and this
in the
is
military.
A specific demonstration project, and we hope that this demonstration project will lead to long-term coverage for those families, but right now this is a specific program.
Okay,
So
take
it's an
advantage of
opportunity
it.
that should not be missed. Let's just walk through what the process is really quickly for families. So you go to your doctor, you request this, you talk to them specifically about Lineagen because we've already gone over why your testing is so specific specific, we want to use Lineagen, then, so your doctor then writes a prescription?
So, yeah, great question, Shannon. And what I might actually recommend is that they contact us first. We do work with many
Once again,
providers.
how do they contact you?
They can call 1-888-888-OPEN. It's 6736. 888-888-OPEN.
Okay.
They can contact us, ask if their physician is already part of our network. If not, one of our healthcare team members will reach out to that doctor, get a kit sent to them, and let them know the benefits if they aren't already aware of it, and then that family can go in, have the swab done there in the office. That kit is then shipped to our facility in Utah the next day, and we take care of it from there. We work with the insurance, as I mentioned. We will reach out to the families, offer them to speak with a genetic counselor, and all within 3 to 4 weeks, the doctor will have a result back.
Okay.